Hi, my name is Tom. I am a cardiologist and co-founder of CardioCube. In my 6 years as a practitioner, I noticed a serious problem. Despite great efforts, heart diseases are the leading cause of death. More than 600,000 people die from heart disease in the US every year. The question is, why? When I see patients in the clinic, I provide them with the best possible care, but ultimately, clinical outcomes depend on what happens at home afterwards. This is one of my patients with heart failure, who we'll call Oscar. After seeing Oscar in the hospital, I sent him home with a long list of care instructions. But once Oscar is at home, now he is on his own to manage his disease, and I am not able to easily see how Oscar is doing. This is overwhelming for him, but also very difficult for me and other providers to catch problems early. That's why over 1/3 of heart failure patients like Oscar get back to hospital just within 30 days of discharge. These readmissions are associated with high morbidity and mortality, devastating for the patients, while hospitals are financially penalized for this situation. And this is really critical. With more than 130,000 unplanned readmissions every year in the US, this problem costs hospitals about $3.5 billion annually. That number will grow as the prevalence of heart disease continues to rise. So how can we help Oscar and millions of patients like him to manage his condition? At CardioCube, we've created an everyday support tool that helps patients manage chronic heart diseases. It happens through casual, personalized conversation because voice is the most natural form of communication. Our software is integrated with all voice platforms currently available on the market, including Amazon Echo and Google Home. With CardioCube, I can send Oscar home with a preloaded, physician-directed care plan. CardioCube checks in with the patient every day to have a brief conversation, asking about treatment, clinical signs, problems. This information is automatically computed and uploaded to the EHR. Let's see how a conversation Oscar may have with CardioCube.
Hi, Oscar. How are you doing today?
I'm pretty good, thanks.
Do you still feel shortness of breath while walking up the stairs since Dr. Tom changed your medication?
No, my breathing is better today, but I have had some chest pains.
Oh, I see. But tell me, does the pain radiate into the neck, shoulder, back, or down your arm?
Yes, exactly.
Okay. Thanks for sharing that with me, Oscar. I will make sure Dr. Tom is aware of that.
CardioCube can tailor conversation, use the gathered data to predict complications, alerting doctors only when it is really needed. It is possible because our interactive voice-based AI software is built on clinical guidelines coming from the top-notch cardiology institutions. By talking with CardioCube, we are able to boost Oscar engagement, which improves outcomes and provides more data for automatic analysis. Hopefully, Oscar will be okay and healthy, but with CardioCube, I will be able to detect early signs of disease deterioration before he lands back in the hospital again. Today, there are more than 28 million adults diagnosed with heart disease in the US. We charge hospitals and insurance companies a subscription fee per patient per month, which adds up to $24 billion revenue opportunity. We are supported by internationally recognized clinical experts like Dr. Timothy Henry and Professor Michal Tendera. This month, CardioCube will become FDA-approved Class 1 medical product, and we plan to achieve Class 2 clearance in the future. We are fortunate to be working with the best hospitals in the world, like Johns Hopkins, and I'm excited to announce that we finished testing with patients at Cedars-Sinai. We are now ready to begin testing at homes, which is the last step in developing a market-ready product. Our team of dedicated doctors and engineers is very well equipped, and we already driving forward voice technology in healthcare. CardioCube is now poised to lead in the use of voice interface technology for remote patient monitoring and management. Thank you.